Hi and welcome back. This is Dr. Kaiser. Today we're going to talk about how much salt is too much. In other words, what is making me so salty? First of all, let's talk about table salt versus sodium. People ask me this question all the time. Doc, how is table salt and sodium different? Or are they different? The simple way of answering the question is that they're similar. So table salt is sodium chloride. Sodium is just the element sodium. But in chemical terms, we can just say that salt is the result of a compound formed from a reaction with an acid and a base. Therefore, someone can have sodium chloride. Somebody can have potassium chloride. They're both salts. But for the benefit of today's topic, we're going to just discuss table salt. And just realize that both table salt and sea salt contain 40% sodium, 60% chloride. So beware of sodium or salt if you have any of the following. If you dehydrate easily, meaning you work outside, eat or drink too much caffeine, or drink very little water. If you have chronic fatigue syndrome or chronic pain, chronic headaches, congestive heart failure, kidney disease, especially if you're on dialysis, liver disease, including cirrhosis, diabetes mellitus, obesity, or of course, high blood pressure. If you have any questions of how sodium or salt makes any of these worse or causes any of these, put a question in the comment section and I'll address that. So first we have 1 teaspoon, from left to right. 1 teaspoon you would drink with, 1 teaspoon you'd measure with for cooking, and 1 packet of salt is 1 teaspoon of salt. So people ask, Dr. Kaiser, how much salt do I need? I get asked this question every day. So here you go. 1/4 teaspoon is all your body needs for the nerves to impulse, for nerve impulses to function, and for your muscles to contract, which is 575 milligrams of sodium, which is half of a teaspoon. However, the average American uses 1.5 teaspoons of salt every day. The maximum amount is 1 teaspoon salt. That's recommended for people 14 years of age and older, which is actually 2,300 milligrams of sodium. However, if you have high blood pressure or pre-high blood pressure or hypertension, pre-hypertension, you only need 2/3 teaspoon of salt. Anything exceeding this causes complications. So just realize if someone places you on a low sodium diet, that tends to mean 2,000 milligrams of sodium, which means that is less than 1 teaspoon of salt per day. Not per meal, but per day. So this is what that looks like, from left to right. 1/4 teaspoon of salt. Next you have 1.5 teaspoons of salt. Next you have 1 teaspoon of salt, but if you have high blood pressure or pre-high blood pressure, the far right is 2/3 teaspoon of salt. So what does all that mean with foods? Without further ado, here we go. A medium potato is the far left. 14 potato chips or 14 tortilla chips is the middle. But the maximum amount, if you have high blood pressure, is 2/3 teaspoon, which is that one on the far right. Next we have chicken noodle soup versus ramen noodles versus maximum amount allowed if you have hypertension, the 2/3 teaspoon of sodium. You see that both of these two, chicken noodle soup and ramen noodles, almost exceeds the amount that someone needs for the whole day regarding sodium. You see here, 3 ounces of pork chop on the left, 3 ounces of ham in the middle, or the maximum amount allowed per day of salt if you have high blood pressure. So that's a lot of salt for 1 meal, which you need this amount of salt per day if you have high blood pressure. If you get a 1/4 pound cheeseburger, that's the left. If you go to a picnic, you need these items, that's the middle, versus the amount of sodium daily if you have high blood pressure. You have to ration your salt carefully because this can easily be your whole daily amount of sodium if you eat all this at a picnic. So Too much of a good thing is definitely a bad thing. And please don't stay salty, my friend. What you can do, have any questions, put it in the comment section. Share this as much as you'd like to for those who may be salty, and subscribe if you'd like to. Otherwise, see you next topic.